there, welcome to the clinic. I am Dr. Rachel, and I will be conducting your cranial nerve exam today. Is it okay if I just confirm your name? And your date of birth, please? Yeah, we just need them through, just to check that you are who you say you are. Amazing. So, I have to get your consent before we get started, so am I okay to perform this operation on you? Yes? Perfect. So if you just take a seat, slightly elevated, we'll get started. Okay, so there's no formal test that we do to check your sense of smell, unless there's something wrong, in which case we can conduct further investigations. But have you noticed any changes to your sense of smell recently? No? Okay. Amazing. Okay, so the first thing I've got to do is inspect your pupils. I just have to check the size and the shape and check if they're symmetrical. You're looking pretty symmetrical. I think the looks maxers would like that, although as your medical professional, I don't think I meant to say that, but they're looking, from a general point of view, to be okay. However, now we're going to test your visual acuity, essentially just how good your vision is. So, do you normally wear glasses? Yes? Okay, if you could just put the glasses on for me, and look at this chart. I'm going to hold it a relative distance away from you, and can you read the second line for me? Amazing, good work. What about the fourth line? Can you read it for me? Yeah, no bother. What about the third to last line, this one here? Can you read it for me? I'll rotate it a bit for you. Yep, good try. Might be missing the one in the middle here. It looks kind of deformed, so I don't blame you. And then give me your best go at the second to last line. Amazing, good work. You did very well. You might wonder, why is my medical professional whispering? It's a new innovation in the medical field. Apparently it brings our patients more relaxation if we whisper, so I've been advised to do it. Okay. So, what I now want you to do is to take a hand, and put it over one of your eyes. Just put it over your eye. Now, what I'm going to do is I'm going to shine a light into your eye. We're going to test the contraction of the pupil. So keep a hand over your eye, and then I'm just going to keep the hand there, please. Keep the hand there. And just one more time, just because I'm noticing a slight abnormality in this one. Okay. Your eye is probably not contracting properly. Do you spend a lot of time on your phone? That could be a reason, but let me just... It's nothing to be too concerned about, but if you could just cover the other eye, please. So swap the hand, and I'll just check the other eye, see if it's a problem on both eyes. Well done. And again, well done. And one more time. Well done, well done, well done. See, it seems to be only a problem on this eye. Well, for you, this eye. But it's not. It's a very minor issue. I'll refer it to your GP or whoever your normal service provider is, and they might just give you like a blue light filter in your glasses. Anyways, the next test, I'm going to swing the light from eye to eye. So we're just seeing how the other eye responds, not the one that the light is being shined into in response to the light. So it'll be very short. We're just going to go. Oh, it's very bright. We're just swinging it across, swinging it across, swinging it across. Amazing. Your eyes are responding fine to that, which I'm sure you'll be glad to hear. Okay, the next test, what I want you to do is I want you to look away from me into the corner, something distant in the room behind me, maybe my bookshelf over that way, or maybe something a little bit further. Just keep looking there, and then I want you to focus back on my thumb. So keep looking away, and now focus on my thumb. And then again, look the other way now. So maybe at something on this side. Keep looking, and now come and focus on my thumb. And one more time, look at that side. Keep looking, and now focus on my thumb. Amazing. Your eyes are fine apart from that minor thing we found earlier. But we're just going to check your vision in terms of colours now. So, unfortunately, some of our equipment has got lost, so we're having to do it a little bit differently. But I need to look at the tip of this pen. What colour is this, please? Colour. Amazing. What about this one? On this one here? The one that I'm wiggling. Perfect. And the other one? Easy, amazing. And then this one I'm wiggling. Amazing. And then this one. Perfect. Just got a few more. What about this one? And what about this one? Yeah, they're the same. Well done for identifying that. Good stuff. The colour, you don't seem to have any kind of colour impairments, which is good. Which is always good. However, maybe that's something you would have brought up. However, what what we're going to do now is we're just going to check your visual field. So I've got 2 fingers on either side. I'm going to wiggle one of the fingers and you're going to tell me what side it is. Ready? What side was that? 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 Amazing. You even got the last one when both of them wiggled. Good identification. Means your visual field is probably okay. Well, you'd hope so, given that I'm the physician. Okay, what we're going to do now is you're just going to follow my finger. You're just going to follow my finger. Ready? Just follow it, follow it, follow it, follow it. Keep following, keep following, keep following, keep following. Okay, amazing, okay, amazing, okay, amazing. Your eyes completely, that's the last test. Okay, well done, well done. The next thing we're going to do is I'm going to get you to close your eyes. It's going to be assessing your nerves in your face. So I'm going to touch you with a sharp or blunt object. You don't have to tell me whether it's sharp or blunt, or ideally you would, but just shut your eyes and say yes every time that you feel me touch you. Ready? So shut your eyes. Ready? Amazing. Tell me if it's sharp or dull if you can. Amazing. Amazing. Good work. Good work. Good. Okay. Good. Good. Okay, well done. Well done. Your facial nerves are looking okay in terms of touching. What I now want you to do is raise your eyebrows as high up as you can. Raise your eyebrows as high up as you can. Good. Now scrunch your face up. Try not to let me undo it. This will be hard if you've had Botox. So if you've had Botox, maybe let me know now. And then blow your cheeks out. Don't let me deflate them. Well done, well done. Okay. The last test is, have you had any change in your hearing? Anything that you've noticed? Any change in your hearing that you've noticed? No? Okay. Unfortunately, we don't have a tuning fork, so we can't complete all the audible assessments today. I told you the equipment got lost. But I'm going to say 3 numbers into your ear, and you're going to repeat them back to me. They'll be individual, not as a sequence. So, ready? 17. What number was that? Amazing. 32. What number was that? Good work. 64. And what number was that? Good, good, good. Looking good. Okay, now the other ear. 11. Not like Stranger Things, no. Okay, well done. 22. Amazing. And one more. 29. Okay, hearing also looks good, which is very good. Okay, well, concludes our assessment. Apart from the blue light filter in the eye, everything looks normal. I'm glad to report. Thank you for coming in today and letting me perform the assessment. I hope you have an amazing evening.